Hello everyone, my name is Raj Khillan and I'm a pediatrician and founder of Healthcare Awareness Society of Australia. As you know, every week we are bringing a panel discussion on some of the health related topic and how COVID and lockdown is impacting all of us. Today we are discussing about COVID, lockdown, and domestic violence. Anecdotally, we all know that domestic violence has always been in our society. It is a nuisance, and this has gone worse during COVID time. Though we don't have a very concrete data how much it has increased, but more recently, there is a first national survey done by Queensland University of Technology, where they surveyed 346 domestic violence provider, and it was found that 67% increase in the incidence of the case report or telephone call from them. And keep in mind, this is the incidence of survey time was from June last year till August 2020, not this year. So we can understand last year's situation was slightly different than this year. Now there is a number of COVID-induced lockdown has increased, and we are going through 6 lockdown. Last year, Sydney was not in lockdown. So there is an added pressure, and this means the number of the incidence of domestic violence has increased many-fold during this time. And to discuss this issue, I have expert panelists with me, and I would like to introduce each and every one by one, and then we'll go into the more in-depth discussion how domestic violence is impacting our community and how we can detect it early and what we can do to make life better of all the women. So first of all, I would like to introduce Dr. Manjula O'Connor. Manjula O'Connor, she does not need any introduction. She herself is an introduction for herself, and she's a clinical psychiatrist, adjunct professor, University of New South Wales in Department of Social Services. She's a chair of Family Violence Psychiatry Network of Royal Australian and New Zealand College of Psychiatrists. She's a senior fellow with University of Melbourne. And I have a great pleasure and opportunity to work with Manjula for a long time as the member of Doctor Against Domestic Violence group. She's the first lady who led the campaign to raise awareness about dowry issue in Victoria, and successfully she initiated that move and being successful in getting legislations passed in Victoria last year. First of all, Dr. Manjula, I would like to congratulate for you all the achievements you have done and working hard for our multicultural community women. Thank you very much.
Thank you. Thank you so much. I'm so happy to be here today.
Thank you. Next panelist, we have Dr. Nupur Kataria. She's a specialist periodontist in Melbourne. She's been working in private practice for many years, and she has a past experience as a senior lecturer in University of Adelaide and also University of Melbourne. She's the avid advocate of women rights and gender equality. Her philosophy of fighting the menace of domestic violence is to harness the involvement of larger community in recognizing the problem, raise voice against it, and educate women for their rights. And she's also an active member of Doctor Against Domestic Violence group. Welcome, Dr. Nupur.
Thank you, Dr. Khillan. It's an honor to be here on this panel, and I hope to bring in and raise awareness for this really, really critical issue.
Thank you. Next panelist, Dr. Preeti Khillan. She's a consultant obstetrician and gynecologist at John Carter Hospital, which is a women's and children hospital under Western Health. She's a director of Western Specialist Center and been very active and passionate member of Doctors Against Domestic Violence group. And she's been working on these issues for last many years with plenty of experience and first-hand experience being an obstetrician, having the longest touch with women for 9 months. And I'm pretty sure she will add a lot in what she sees in her daily practice. Welcome, Dr. Preeti.
Thank you, Dr. Khillan.
Next, we have Ashima, who is a PhD in psychology, works as a provisional psychologist. She's been trained internationally and within Australia with more than 12 years of experience in teaching and counseling. She's a family violence case manager for a multicultural organization which support women from migrant and refugee background. She has been working and has worked in the past too in multiple settings, including Monash University, RMIT, and other non-for-profit organizations. Welcome, Dr. Ashima.
Thank you, Dr. Raj.
Thank you. And next we have Meena with us. Unfortunately, she is the victim of domestic violence. We have changed her name to hide the identity, and we would like to hear from her more of her firsthand and the horrible experience what she has gone through, which really broken our heart and put all of us, the expert group, together to discuss this issue and taking this issue as a prime issue to help a more wider community. I would like to now invite Dr. Manjula to moderate the whole discussion and take it over from here from me. Thank you, Manjula ji.
Thank you, Dr. Raj. It is so good to be here and to share our experience with the community, and to lead us through this will be our main guest, Meena, who I will come to in a few minutes. But just giving facts so people know the context in which we are working. Family violence or domestic violence, we use them interchangeably, affects 1 in 3 women in Australia, and it affects 1 in 3 women across the whole world. There is no society, no culture that is spared. It is amazing. Domestic violence is absolutely ubiquitous, and it's been going on for thousands of years, but it's only in the last 20, 30, 40 years that people started talking about it, and in the last 20 years it has become a vigorous area of research, and we know why domestic violence occurs. We know it is about imbalance in power, and we know that it is abuse of that power, but that abuse of power can occur due to number of other factors, for example, loss of job, migration. There are things that make that imbalance of power much more acute, and the person who is powerless in that relationship becomes the victim of abuse, physical, emotional, sexual, financial, and as you mentioned, we found that dowry abuse is a specific form of financial abuse that occurs in South Asian communities that we found that was happening in Australia, and is happening because the Australian residency gives the grooms a more of a power over the bride, who would be perhaps back home in their country, and the NRI grooms are very highly valued, and so that increases their dowry value, and then there can be ongoing demands. And so that's the context. And in my practice as a psychiatrist, I see hundreds of these women. And what I've found, like everyone else, that during COVID period, the domestic violence rate increased, and I had a huge number of calls from the community, people who are not my patients, because as you know, I work in the community and have my NGO, the Australasian Centre for Human Rights and Health, and mostly the abuses were around being financial abuse, taking the woman's money, and then debts on her head and throwing her out of the house. So, but what happened in COVID generally was that women could not get away from home. They lost their jobs. sometimes, their husbands lost their jobs, and that meant that too much closeness. Mina, you may want to mute your mic for just a few minutes, and I'll call you on. So that kind of it's almost like you're locked in. You're unable to leave home, which then gives rise to increase in conflict, increase in domestic abuse, and increased rates of domestic violence. So the police reported a 40% drop in crime overall, but a 5% increase in domestic violence. Google reported a 75% increase in internet searches related to domestic violence. And 1,500 women who took part in research by the Australian Institute of Criminology, there were suddenly 5% women were experiencing abuse that they had never done before. 6% women experienced coercive control. 12% women experienced one form of emotional abuse, harassment, controlling behavior. And there were a lot of safety concerns and barriers to seeking help, which meant that the domestic violence rates went up. And fortunately, we can say that we have not seen an increase in suicide rates, but we probably, not quite clear, but we don't know whether there's been an increase in homicide rates. It'll become clearer at the end of the year. So to highlight these issues, I have invited a survivor of this abuse, and we have given her a name, Mina, which is a made-up name. And I'm going to start asking her to share her experiences. Just to quickly introduce Mina, she was married in India, and they both were married in India, and they both came to Australia together on her on a visa, a student visa. So now I'm going to ask Mina. Mina, would you please? Are you with us? Would you unmute your mic?
Yeah. Yes,
Hi,
doctor.
Mina. Hi, Mina. Welcome on the show, and thank you for sharing your very difficult story. I know you're doing it to help others. So, starting with what happened after your marriage in India. Was it always a good, happy marriage, or were there issues starting early on?
Right from the beginning, we always had issues in our marriage. So where my husband was blaming me for his business loss and all other stuff, and then he would be demanding money from us, dowry from us, so he could actually settle down in life. But each time I refused, he got really abusive and would be using like really foul language for me and my family.
Okay, so already things were not quite good, and
no, they were not.
You came to Australia, and why did you come to Australia?
Just because my husband's business was downing and he was in losses, so we had to move to Australia so he could get settled and pay off his loans. And then he forced me to move to Australia, where I wasn't ready, just because his behavior wasn't good in India. So I didn't want to move here with him. So that's why. But he forced me that we have to go to Australia whatsoever, so he could pay off his loans.
And you came here on student visa.
On student visa.
And who was the student?
I was the student here, but we took education loan to be here, and then he was constantly harassing me that I have again put him in loans and I need to pay back my student loan as well.
Right. So this is a coercive, controlling behavior that started from the very start.
Yeah.
Right. So after coming to Australia, what was his behavior towards you?
It was slightly better, but it was always controlling, where he wanted me to do things according to his way. And anytime I would refuse to do that, he would get really abusive and calling me with vulgar names. And also, he was demanding money constantly from me, whatever I was earning. And also, he used my credit card, which he's refused to pay later on, saying that because the credit card is in my name, so I need to pay it back.
And so all the money that you were earning, he was taking, right?
Yes, he was. Like every now and then, I was just giving him money.
Right. And so, and did you want to give him that money?
No, I really didn't want to, but he was actually forcing me all the time.
Right. And so, in modern terms, that is called slavery, right? And that you cannot take anybody's hard-earned income without their full permission. You cannot control their bank account. And slavery is a federal crime, and it can lead to jail sentence. So people need to be aware, if they think that their money is being taken away, they can complain to police. This is domestic violence, but it is a very severe crime as well. So, Meena, coming back to now, what happened then during the COVID lockdown period?
So 6 months before we went, the COVID was there. My baby was born, and since then my husband became really abusive as soon as I had a baby. And then when COVID had started, so he actually had COVID symptoms, so he self-isolated himself. And then once he came out of that isolation, things got really bad, where he wanted to hit me, and also he got really abusive towards myself and my son as well. So there was chaos in the house all the time, where he would be yelling at me and fighting with me for no reason, and my son was always scared.
Yeah. Were you scared?
Yes, I was always in fear that he would harm me, and was always stressed. And also back then I wasn't earning because I was on maternity leave, and he was constantly demanding rent from me, and he said he would kick me out of the house if I wasn't paying him any rent.
So I just like the viewers to think about this. What a terrible situation Meena would be in, with constant feeling of fear and threat. In her, how it would affect her system, the stress that produces continuous stress chemicals. Your heart is racing, you're constantly tense. And I know Meena's sleep was disturbed during this time. And what was the effect on the baby?
So my baby was in a very terrible condition, where he would be cranky all the time, crying, screaming, and not eating properly. And also he would be literally not letting my husband touch him at all. And at night he would be just sleeping on my chest. He was so insecure.
Yeah.
And he was such a grumpy baby, all the time fighting. He would be slapping on my face all the time, and I was wondering why he was slapping me when I never did that to him. He was literally just hitting me.
Really?
And he's got speech delays as well, but now I notice he's a lot better.
Right. So the good part about it is that you are now in a much better state, right?
Yeah, absolutely. Looking at him, I feel he's a lot changed now. His behavior has become quite better. Now he doesn't hit me anymore. And he's quite calm now and happy as well.
Great. And so that happened from which point? Why did he start improving?
Just when the child protection, they got us separated, and my husband was separated from us, so he was asked to leave the house. And after 10 days, I could see a major change in his behavior, where he started sleeping properly. And now what happens is he sleeps through the night. Last night he slept at 9 and woke up at 9 this morning without any problem overnight. He sleeps really well.
That's amazing results. I'm now going to come to Dr. Preeti. Dr. Preeti Khillan, you are an obstetrician and gynecologist. Can you tell me why people like Meena should talk about domestic violence with you? Why should they share their story with you?
Thanks, Manjula. Look, this is such an important and relevant question for me, especially because it's in the scope of my practice as an obstetrician and gynecologist. Think of it, pregnancy is a very joyous time for a woman and her family. This is what it is meant to be. But what does pregnancy do? It brings a lot of emotional turmoil in a woman. It causes a lot of physical changes in a woman's body, and sometimes that could add up to social stresses. And often, it could also bring about financial constraints in a woman's life and as a family. So, as an obstetrician, healthcare worker, I think it's an excellent time to build a long-term relationship and bonding with a woman. Pregnancy is for 9 months. There are very frequent antenatal visits, and that's exactly the time, I think, when that bonding can come. The woman can have that trust in this relationship and open up. Now, what is done for this is that in Victoria, we have a screening set of questionnaires, which is mainly directed to detect physical abuse, emotional abuse, and fear in a pregnant woman. And it is handed out to them at their initial antenatal visit by the obstetrician or the attending midwife. An excellent opportunity it provides us to screen women for domestic violence, whether it was pre-existing or a new onset of domestic violence. Looking at it, why is it so important? Yes, if we look at the national data on domestic violence in pregnancy is very sketchy and patchy. And I think there's been a national drive to find out exactly as to what the incidence of domestic violence is in pregnant women. But if we look at the existing data, what we have, which is reported, but it just doesn't speak for the underreported ones, is up to 5% of women can experience it, especially between the age of 18 and 24. Vulnerable age for a woman to be a mom and also experience domestic violence. Again, it could be because of unintentional and unplanned pregnancies. So I feel as an obstetrician, it gives me an excellent opportunity to screen women and provide that support and direct them properly, So this is what I feel is very important, and it gives me, I have the privilege of, being in contact with women for a long time throughout pregnancy.
Right. Okay. I'm going to come to Dr. Raj Khillan now. So the baby, Mina's baby, was very obviously distressed and fearful and, clinging, hitting her, speech delayed. Why do you think this would happen to the baby, and what can the pediatrician do for such a situation?
Manjula ji, look, this is a very typical behavior in a child who witnesses domestic violence. We do see domestic violence does affect the child's emotional development, social development, and also the physical development. And if we go to in general, the development of a child, the emotional development of the child, the social development of the child needs a very socially safe environment to nurture, safe environment to grow, to rear up. And this is the growing age when the children learn everything. Their brain is multiplying, the social skills they are learning, and they are learning how to interact with people in the family, outside the family, in childcare, in kinder. And generally what I say to my patients and parents, particularly, children are our mirror image. Whatever we show them in the mirror, and this is our face, and they will give us back to us in the same way. If a child is witnessing domestic violence and hitting every day by a man or a woman to the other partner, and that will be taken as a normal norm by the growing child. It's an immature brain. So that child will take hitting is a normal thing. So child on a different age group react totally differently. And particularly if we talk about Mina's child, I don't know what age, but I believe from the discussion what I understood, the child must be somewhere less than 1 or around 1 to 2 years of age when these things were happening. So this is the age when the child is in a very growing age. And typically, as she said, the child was not sleeping well. That anger the child was showing, because he witnessed that anger is the only way to express yourself. That he was hitting mom. He does not understand that the hitting is right or wrong, but this is what he has seen. So he will hit other children also when he goes to childcare, when he goes to kinder. He will have difficulty in sleeping to look at the nightmare or the flashes or the issues what he's facing during daytime. That will go to his subconscious mind, and he will wake up in the night with the terror and the nightmare, and will not be sleeping with anybody else except the mom, and also will, because of that fear, will be waking up. Child during this age maybe become very shy and hiding away from other people. They get more insecurity, separation, anxiety, become more clingy to mother, as Meena has said very rightly, that he was so clingy, he was not going to anywhere, was sleeping on her chest. So they become so clingy because this is the only place they can get some comfort. So the child is looking for that comfort, and due to that look with the sort of a self-protection to themselves, they are left behind for their social development, what the opportunity they can get going to childcare, going to kinder, meeting with other children, learning communication skill, the learning the language, learning the social skill, the emotional development. Yep. Child during this age, like a less than 1 year, generally, as I said, the mirror image. The child learn smiling, laughing, giggling, babbling, reading mom's emotions. Yes. And if the mom's emotions are masked because of this, the depression, or because of this anger, because of the fear she is going through, then the child development is going to be affected. The child emotion will also be blank. Yes. And I have seen children with domestic violence, they are showing a similar signs of as clearly of autistic child. Yes. They show the social delay, they show speech delay, they are anger, significant temper tantrum, they start wetting back again, toilet training is such an issue, very anxious all the time. So typical signs of autism we do see in children with domestic violence. They are under so much stress and their development is regressed significantly.
Yes, thank you. And so it's so very important that the mothers who are going through such domestic violence, they should share with their pediatricians if they are, recognizing any symptoms of delayed development, delayed speech, sleeping problems, feeding problems, socializing problems, eye contact problems. They should speak to their GP and get a referral to pediatrician as soon as possible, and don't delay it, because the longer you delay it, the worse it gets for the child. And as we heard from Meena, the separation has been the best thing for the child. The child is now growing beautifully. So now I'm going to bring Dr. Nupur into this. Dr. Nupur is a dentist, and I can tell you that when I gave a first lecture on domestic violence and dentists, people had never thought about it as to what dentists, why should they be interested in domestic violence? And so then if you think about it for a minute, where does the man punch the woman? Generally, it's around the face, and generally it's around the teeth. And I have seen women whose teeth have been, and jaws have been smashed, and that has taken years to fix and not even been able to be fixed, and so expensive. So I'm going to ask Nupur to come into the picture now. Nupur, would you like to explain to us why and how do the... sorry, there's somebody's mic echoing. Why should the women share their experience with you? And what can you do for them?
Okay. Thank you, Manjula ji. I think dentists are in a very interesting sphere. Victims of dental violence they can find a dental clinic as a very safe place to open up about their suffering. During lockdown, especially when most of the community is in prolonged social isolation, going to a dentist to seek urgent dental care is one of the valid reasons to leave home. So the victims can actually use this opportunity to seek help. And talking to a healthcare professional like a dentist could be a starting point towards their well-being journey. Often dentists are one of the first responders. We often use an acronym, AVDR, to manage such situations. So when patients come to us, they can come to us in a very veiled manner. They might not present to us in a usual manner. And if there is something suspicious, some telltale signs as this is not a regular occurrence, we can ask about that injury. We can ask about that sign. And often all it takes is for us to validate that, this is not something right and we have picked up something, and they can open up. They find that they can open up to us. And one of the reasons that they feel that they can open up to us is also because in Australia, family dentists actually have a very prolonged role to play. So just like how women go to gynecologists for regular care, people go to dentists for regular episodic care every 6 months or annually. And sometimes you can have very long-term working relationships and working rapport with such people. And when they find that, yes, they are in a safe environment, it's interesting how many people open up. Often they might not even come for themselves. They might come to seek help for their children for a dental care, but they might open up to a dentist or a dental specialist. And the other thing that we do is we document the signs of abuse very well. And dentists inherently are very good with note taking, and they can actually, as you mentioned, that most of the injuries are on the face and head and neck. So they can actually, they are trained to look at those injuries. This includes, fractures of the jaw, but it could also include very different things. Sometimes people just don't present very well to us. They look very intimidated. And so that documentation can actually be used as an evidence if required as well. And then the last thing in this is referring. So, when people come to us, we can refer them to a dental violence specialist support group. So that is where we see most of our things. And especially during lockdown, I think it could be used as a very good opportunity to seek help.
I will now ask Dr. Ashima Soni, who is a family violence who's a family violence worker, and she has also, helped hundreds of women who have been in the same situation as Meena. What is your experience? How are women presenting to family violence services? Do they come early enough, or do they come, fairly late? What is your experience?
Thanks, Dr. Manjula. With my experience, what I've come across is that women from migrant and refugee communities sometimes don't know that what they're experiencing is family violence, particularly if there is no physical abuse. So abuse can be in form of verbal abuse, psychological abuse, emotional, spiritual threats of deportation, or there's visa abuse or technology facilitated abuse. So when I speak to women, they are sometimes they are unaware, because if there is no physical abuse, a woman might be unaware of that what she's been experiencing is family violence. And that is something very much prevalent within clients from culturally and linguistic diverse backgrounds. And so there are early signs within a relationship that someone can see, and we often call those as warning signs or red flags that are an indication that a relationship has become unhealthy and it could escalate into family violence, because it is uncommon for a person to become highly abusive in a relationship straight away. So first they might start to gain power slowly in a subtle ways, For example, it could be you can't go out because you are new to the country, but it might be a subtle form of control in a relationship. And some of the early warning signs could be of abuse could be, does your partner refuse to take responsibility for things or is always blaming you or someone else? Does your partner want to know where you are all the time? Does your partner call or text excessively throughout the day and gets angry if you don't respond? Does your partner check your phone or social media and controls who you have been talking to? Or does your partner break or throw away objects? Or as simple as, are you even scared of your partner? And if you've answered, or if this answer is yes to any of the questions that I just discussed, there are these elements that the relationship is unhealthy and may develop into situation of family violence.
Sorry. Okay, sorry. I'm going to ask Meena to unmute your mic, Meena, for a moment. Did you recognize that you were going through domestic violence?
Not really. No, I didn't feel that unless actually CPS got involved and through someone actually told them about my case, and then they interfered and then they got me out of this. Till the end, I wasn't ready, where they came to the point and said, like, your child, will take your child. If you don't agree to go out of that house, we won't let your child go into that house.
Really? Okay. And otherwise you would have stayed in there.
Yeah. I was very much like, I wanted to stay because I didn't have enough finances to support myself. But they were like, we won't let your child go. If you want to go back, you can.
Right. So without the finances, that was the reason why you would not have left the house.
Yeah, that was the main reason.
And which is the biggest problem with women who are on temporary visas. They can't leave the house because they think there will be no support. And I want to say this to all the women who are listening out there. If you're on temporary visa, like a student visa, or you're a partner of a student visa or a skilled migrant visa, that the government, we have advocated very hard for you, and now the government will give you money, will give you Medicare, will provide you with housing until the next steps become clearer about your visa and what you're going to do. So do not stay at home with a violent person if your life is at risk, because the government of Australia and Victoria have done everything possible to support the women. With the immigration department, if you are a partner of a person who was permanent resident and he is no longer willing to sponsor you, the immigration department will give you a residency visa. But you just need to make sure that you get to In Touch Multicultural Center as soon as you can, and they will start the visa process for you. Or at least speak to the police or speak to 1800 Respect as soon as possible, and your visa process will be started and you can get a visa. You do not need to stay with a violent person. I want to come back to Dr. Preeti here for a minute. Dr. Preeti, we know that 26% of all domestic violence happens during pregnancy. What is the direct impact of violence on the fetus, on the baby when the baby's in mother's stomach? Tell us, what do you think can happen to the baby in utero?
Thanks, Manjula. Again, I'll start with the fact that a woman needs a lot of emotional support when she's pregnant, to look after herself, to meet the additional nutritional demands for her personal care and hygiene. So we could imagine that in a situation where there is domestic violence prevailing, she is not able to look after herself, leading to, adverse consequences for her own mental health and also on the pregnancy. COVID definitely has aggravated this because women who had been expecting family support from overseas or locally, obviously this has not been happening. And I see so many pregnant women who come in and they're desperate to get their families from overseas, but we have not been able to help them in this aspect. Now, with pregnancy and domestic violence, there has been definitely seen that there's an increased risk of miscarriage in the first trimester. However, if the pregnancy goes on, there is this increased risk of preterm delivery and low birth weight babies. Also, the time of labor and delivery, where there's a lot of emotional and social support which is needed by a woman because they've been bereft of it. And if, suppose it's a violent partner who's been, they've been living with, this creates a disastrous consequence on the woman's health and mental health, leading to, maternity blues, onset of postnatal depression. Now, after the labor and delivery, there has been definitely seen that the risk is of very decreased bonding between, the mother and infant. And also, breastfeeding is a challenge for these women. So all this, where does it lead to? With this sort of a happy moment, it leads to, less bonding with the infant, decreased breastfeeding, depression, postnatal depression, ending up to the stage of psychosis. So look, definitely a direct impact from domestic violence is seen in pregnancy.
So would you want to give one last message to women who are pregnant and going through domestic violence?
I'll tell all the women, look, speak up, seek help. There are health professionals, so many helplines around. Please, look after yourself. It's a very big time, for yourself, to look after yourself and your pregnancy. So please speak up if you haven't, and seek help if you have not done it so far.
Yeah, because if the baby is already unhealthy and undernourished and not getting emotional support during not only during pregnancy but also after birth, then that child's future is compromised forever. And that is the thing to remember for mothers who are going through domestic violence, that you are putting your child's future at risk if you don't seek help. I'm going to now come to Dr. Khillan. Do you think, we do have research that shows that children who were brought up in aggressive, violent homes go on to become the perpetrators. The boys go on to become perpetrators and the girls go on to become victims, right? So based on that, what advice would you be giving mothers and parents, fathers and mothers who are in the situation of domestic violence? You're on mute.
Manjula ji, thank you for bringing this a very, very sensitive and very important topic, because it is important, as you said, we are the mirror image for our children, and children will learn what we teach them. And children are the tomorrow's men or women. So what we see, is it the question, are we going to do the same things in future? If I witness a domestic violence happening, would I going to be taking this as a normal norm and hitting my wife also in the similar way when I become adult? Or if I'm a woman, would I keep suffering in the same way? And as a girl, would I keep suffering later on? So that's where I will more concentrate here on the teenage behavior here. The teenage, when they witness the domestic violence, they behave totally differently than the little children. Little children may have a sleeping difficulty, temper tantrum, and that side of bedwetting, thumb sucking, not sleeping well, hiding away, shyness. But in teenage, they can be a totally different behavior. They can go into the stage of aggression. Particularly boys, they got more aggressive because they think that is a normal norm. And as you very rightly said, boys are 10 times nearly more likely to be perpetrator in future, and girls are more likely to be, teenage girls, more likely to be sexually abused when they grow up, if they witnessed domestic violence, because the girls learn there how to be suppressive and not to speak up for their own right because they saw their mummies not talking about it. So that's where my message would be here. As a parent, important thing to talk to our children first. The other thing also come here, some of the children which I would like to say, because which is a very common word and phrase, particularly in our subcontinent, mother talk about, okay, I'm staying in the house just only because of my child.
Yeah.
If the children would not have been here, I would have left you, or I would have committed suicide.
Yeah.
That phrase, when we speak about, that gets stuck in a growing mind and child, and they start blaming themselves. Oh, my mother is going through domestic violence because of me. The self-blame, they go through that, is killing them all the time, and they can never get out of that blame for the rest of their life. That flashback continues in the rest of their life.
Yes.
And that is the major message which I would like to give it to the parents, that don't use these phrases in front of your child, and don't make that, always make sure that you clarify with the child, it is not your blame. It's not your fault. You should not blame yourself. You have no responsibility to protect me from this monster.
Yes.
So it is my responsibility to protect myself. At the time when the domestic violence is happening, if they need to teach our children that they can go to another room. They can, little child can have a cuddle to or hug to the comfort toy, or talk to grandma, or just to distract themselves. For the teenager, generally, I suggest developing a positive relationship with the community, with their friend circle, developing some hobby and involving in a sports activity where they can get the chance to go out. Connecting with the family where there's a healthy, positive relationship going on. So they are not always having a negative impact on their child. That, okay, this is the only family, and it means every family will go through the domestic violence. No, there are positive family, healthy relationship going on. Setting that example for them about the positive relationship, healthy relationship is important, so that they learn in life there is something different what I faced in my life.
Yep. Thank you.
That's the message I would like to give, man. Thank you.
That's wonderful. And that tells us that mothers and fathers should be very careful about how they parent their children, how they behave in front of their children. And if there is abuse and domestic violence, and your child is behaving in a way that is not what you would want them to behave, and if it persists for more than 3-4 weeks, seek help, go to your GP, talk to them, share your burden with them. They will help you. They will make a referral, and you will save your child's future. I'm going to come to Dr. Nupur now. What would you think about? So one of the things that the perpetrators do is that they control the woman. And one way of controlling the woman is to make sure she does not say anything bad about him to any of the health providers, right? So what happens is that the perpetrator will always come to the consultation session with the victim. He will not leave the victim alone with the doctor or the dentist to share her worries and her concerns. Has that happened to you, and how did you deal with it?
Manjula ji, actually, yes, it does. I can reflect back on few cases which were like that. Often what we find is that the victims are very jumpy in our dental chairs. If something like this has happened, they don't like anybody coming close to their face. So there are some telltale quiet signs. I would call it almost like veiled signs that something is not right. if a patient is new to us, then we can pick them up quite. We might not be able to pick them up very well. But if a person has been coming to us for a long time, sometimes you can pick up changes in behavior. And this has happened in one of the cases that I saw in a hospital setting. I had a patient who would come and seek help because as a gum specialist, people come and see me every 3 to 4 months for regular care. And this lady would come of a South Asian descent who would come and who would actually come and see me always with her husband, every time with her husband. And the husband would just loom over around our settings and would not actually leave her even for few minutes also from his hearing span. So, but when we open up the mouth, we can see so many changes. So in this patient, I actually could see some injuries to the lining of her cheek, inside lining of the cheek, and her tongue would be lacerated as well on occasions. And it would get better, and then again she would get it. And nothing in her mouth kind of collaborated with these signs that she should be getting it. Her bite wasn't such that, should be picked up. So on one of those occasions, I took her to a radiographic center and in the hospital. And when we take dental x-rays, we don't want people around. So it's just me and her. And that's when she opened up that she was being slapped and punched quite regularly, and she had tears in her eyes. Of course, we then took action, and because it was a hospital setting then, we were able to report to the social workers who were connected with the hospital people. But even in our own private practice, there have been patients who have just opened up to us on various occasions, and to one of the in one of the cases, they came and a lady actually told us that she didn't have anywhere to live, and her credit cards had been cancelled. And in that case, in her case, we actually did refer her to your support group. Yes, so it has happened actually twice in last couple of years, and especially during COVID times, the frequency and severity has increased. So yes, that's true.
Yeah, thank you. That's a very, very evocative story. And so now I just want to point out the numbers that are at the bottom of your screen, everyone. You can see that there is 1800 respect number now coming up that you can ring 24 hours a day. And then also for any sexual assault, domestic abuse, financial abuse, family violence, counseling, anything, you can ring 1800 respect number. And then there is the In Touch Multicultural Center that works. They don't work 24 hours a day. I think they're only Monday to Friday. And police, if you think anyone's life is at risk, you can even ring if you are worried about the neighbor. If you can hear the neighbor shouting and you think that is something very dangerous going on, you can ring the police. You can ring the police for yourself. I have known people from India ring the police because their sister or their daughter or their niece was going through domestic violence, and the police have acted and given the man intervention order and taken him out of the house, and the woman has got help. Now, I do want to talk about what happens to men when they are removed from their homes. A lot of men do not realize how important the families are to them. They do not realize losing a family is a devastating thing. They are taken out of the house. They become depressed. They become suicidal. They want to go back to the family, but they cannot anymore. The wife, for the first time in her life, is feeling free of fear. Why would she go back? So if you are having problem with aggression, violence, you can ring men's behavior, it's called Men's Helpline. I see there is the number coming up, Men's Line 1300 78 99 78. They will help you before anything dangerous, anything that will happen in the house, before you start drinking too much or before you become abusive. Coming to Ashima, And we've just got 6 minutes left, Ashima. So, what do you think is the impact of all of this domestic violence on the person's mental health? But before you do, I'm just going to talk a little bit about neuroscience here. So we have a brain that is, we call the upstairs, upper story, and then there is the lower story below the ears. The brain below the ears is always the emotional unconscious brain that is working in the fight mode, the flight mode, or the freeze mode when we come across a threat like domestic violence. So you want to run, you want to fight, or you could freeze in fear. The upstairs brain is a logical, rational brain. So what happens in the domestic violence situation? Our logical, rational brain is drowning because the fear is taken over and we are in a constant mode of fight or flight or freeze. And that is the causes the mental health symptoms. So what are the mental health symptoms, Ashima? Would you please tell us that domestic violence can do to people? Perhaps you might want to talk a little bit about post-traumatic stress.
Yeah, so with regards to clients who present with experiences of family violence, there is always this constant fear. So first of all, there's also this fear of mistrust. Sometimes the client can take a long time to open up because they've been made to believe that if they disclose their story of abuse, they might not be believed. So that is the first step, that there are issues related to mistrust. There's anxiety, which can be a prolonged severe anxiety, panic attacks, and clients have also presented with post-traumatic stress disorders because that might be a history of abuse that might be going on for ages together, which might have never been dealt with in the initial years. So clients present with various mental health issues, and because there is sometimes stigma attached to seeking support and help from a psychologist or a psychiatrist, and that can act as in a more negative way if no support is sought. So I just want to point out one more thing, that sometimes language is a barrier. So even if you do not speak the language, interpreters are available. So for clients who do not speak the English or they are unable to convey what they mean in English, please request for an interpreter. It could be through police, it could be through services that are being mentioned below. So services do employ all interpreters, and you can disclose your story in your own language and seek support. So it becomes more easy when therapy is provided in their own language and they are able to discuss. And even at In Touch Multicultural Center Against Family Violence, so the caseworkers there speak over 25 languages. So any client belonging from a CALL background is linked with the caseworker closest to their cultural background.
Thank you. Thank you, Ashima. We have just 2 minutes left, and I just want to say that once the woman who's been living under fear, or whoever is the victim of domestic violence, they start to suffer severe symptoms of post-traumatic stress disorder. So basically flashbacks, constant flashbacks, meaning as if the past is now the present, constant intrusive thoughts, difficulty sleeping, being constantly on the hyper alert, headaches, palpitations, high blood pressure, and all kinds of illnesses like common cold, stomach problems, skin problems, allergies. You know, if you are going through those things, please speak to your GP, because they are the best person who can direct you to the right help. If your life is at risk, please ring the police at 000. If you are able to ring the, if you are a male and you need help, please ring the men's helpline, because you can look after yourself as well as your family and save the future generations. So with this, I just want to thank all our speakers.
Sorry, Manjula ji, I also have a message.
Yes, please do.
I have a quick message because I am dependent on my husband's student visa, which he has a plan to get it cancelled, and I'm not getting any kind of support, but that doesn't mean that I have given up on myself. I still work and I look for a cheap but good daycare for my child, and now he goes to daycare and I work. So that way I'm supporting both of us. So I believe like when I can do it, anyone should be able to do it. Where I wasn't getting any kind of support from the government, but I still stood up for myself and my child that I have to do it whatsoever.
That is absolutely the best final word. Thank you so much, everyone. And we hope that people enjoyed listening and they will look after their health.
Thank you very much.
Thank you, everyone. Thank you.
Thank you.
Thank you.
Thank you. Bye.